The health professionals of Northern Cardiovascular Clinic are dedicated to promoting ideal cardiovascular health. Based upon your cardiovascular risk assessment, we will outline for you and counsel you in the 7 steps to ideal cardiovascular health with specific recommendations based upon your cardiovascular risk assessment. The steps to ideal cardiovascular health begin with healthy habits, including complete cigarette smoking cessation, moderation of alcohol intake, and restful sleep. The next step in the journey to ideal cardiovascular health emphasizes a heart-healthy diet. We provide counseling in a Mediterranean or plant-based diet, focusing on a global diet, not just specific supplements, to promote and develop ideal cardiovascular health. The third step in a journey to ideal cardiovascular health is physical activity. We recommend, based upon your assessment, specific physical activity or recommendations, usually involving at least 30 minutes of aerobic exercise each day. The intensity of exercise and type of exercise depends upon your risk assessments. The next step is achievement of an ideal body mass index. Your body mass index is calculated based upon your weight and height. We offer counseling in lifestyle modifications to prevent obesity and promote an ideal body mass index. The next step is an assessment of your fasting glucose and your risk for developing diabetes mellitus, an important and preventable risk factor for major adverse cardiovascular events. Your lipid profile and risk assessment together determine your healthy cholesterol level goals. We focus upon your low-density lipoprotein cholesterol, the form which often is deposited in the arteries, causing a vascular disease. Your specific target levels depend upon your risk assessment. In general, a typical LDL cholesterol level for a middle-aged person in the United States is approximately 120 milligrams per deciliter. This level, although typical and average, is not a healthy level. Depending on your risk assessments, we may recommend adjustments in diet, exercise, and pharmacotherapy to achieve an LDL cholesterol level less than 100 milligrams per deciliter. In patients with overt atherosclerotic cardiovascular disease, the ideal level may be below 70 milligrams per deciliter. These levels are individualized based upon your risk assessment. Finally, we will promote and counsel lifestyle modifications and pharmacotherapy for the achievement of an ideal blood pressure. The risk for stroke in particular rises exponentially when the systolic blood pressure is greater than 115 millimeters of mercury. Most patients, depending upon their risk assessments, will have a goal of achieving a blood pressure less than 130/80. Lifestyle modifications, including diet and exercise, are the key to achieving adequate blood pressure control. Pharmacotherapy may be necessary to prevent and lower the lifetime risk for stroke and heart failure, which are both closely associated with blood pressure. The 7 steps to ideal cardiovascular health are a journey which we will help you travel based upon your risk assessments.